Very much, Senator Hassan, and thank you to our panelists, and thank you to Senator Tester for calling this meeting. Good afternoon to all of you. We have a full list of bills to consider this afternoon, and I look forward to hearing about each of them and how they will improve the care that veterans receive. I continue to hear from veterans in Kansas and across the country who face what are unacceptable barriers to accessing timely, quality health care that they need. For example, we heard from one veteran who called the Veteran Crisis Line in 2021 and is still waiting for the VA to call him to schedule a follow-up mental health care. We heard from another veteran who paid several $1,000s for dental care outside of the VA because the VA dental exam room could not accommodate her wheelchair. The VA has refused to issue her a community care referral. We heard from yet another veteran who asked for a referral to a rehab program at a non-VA facility in his rural community that had opening for him, but was told to wait several weeks for a bed at a VA facility in another state hours away. These are just three stories, but they are alarmingly common. I've always told people that what I know about what's going on at the VA and what's going on in veterans' lives is by the conversations I have with Kansas veterans, and these are stories that they bring to me. I've introduced a couple of the bills that are on today's agenda as a result of those kind of circumstances. S. 1315, the Veterans Health Empowerment, Access, Leadership, and Transparency for Our Heroes Health Act, would codify the current community care access standards, educate veterans on their rights to seek community care, hold the VA accountable for providing timely access to care, and help the VA keep pace with the best practices for modern medical care in DOD, CMS, and the private sector. The Veterans Health Act is bipartisan, and I appreciate my colleague Senator Sinema for working with me on this legislation. This bill is also widely supported by veterans organizations, including the American Warrior Partnership, and I'm grateful to Jim Moran, who we will hear from on the second panel. He's the President and Chief Executive Officer of AWP and will testify shortly. And because no healthcare system in the 21st century can provide world-class services without a safe, top-notch IT system, S. 1037, my VA Electronic Health Records Modernization, Standardization, and Accountability Act would establish a clear and consistent set of safeguards that must be met before VA can move forward with implementing the new Oracle Cerner electronic health record. Ultimately, this bill facilitates a more thoughtful and evidence-based implementation, increasing the likelihood of success and improved patient outcomes in the long run. Chairman Tester has bills on today's agenda that are similar in certain ways to both of these, the Veteran Health Act and the VA Electronic Health Record Modernization Act, which suggest to me that we can find a path forward working together. I look forward to working together with all my colleagues on this committee and in the Senate as we work to negotiate strong, bipartisan, and fiscally responsible legislative package that contains the best of our bills and the many others that we will discuss this afternoon. And I thank you all for being here, and I yield back.